The question is, if I'm waking up multiple times at night to pee, especially if it's interfering with my ability to go back to sleep, what can I take to help me to maintain sleep? So usually when people are waking up, it's between 1 and 3 a.m., usually around 3 a.m. Is that right for everybody? I see a lot of nodding heads. The reason why is because of how your body manages cortisol. So I'm going to be speaking back to the same point I just made. Cortisol is a stress hormone, and when you make that, or when you release that stress hormone, its job is to send a signal to the liver, and the liver dumps sugar into the bloodstream. We all have a clock that's hardwired into our body that goes off at 3 a.m. and goes beep, 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 and that sends a signal to the stress glands to make cortisol, which goes to the liver, tells the liver to dump sugar into the bloodstream. If we're going to bed at night and our cortisol levels are already high because we're stressed, because we're not sleeping well to begin with, because we're eating sugar at bedtime, maybe we have a couple of beers before we go to bed. Whatever your strategy may be and how you're living your life, then when that alarm clock goes off at 3 a.m., instead of going beep, 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 it goes beep, 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 and you wake up. Does that make sense to everybody? And so that's why you pee at that time. So managing cortisol levels before bedtime help us with patients with nocturia. We use something called Cortisol Manager, which is a supplement that has ashwagandha in it. Ashwagandha has some excellent data as an anti-neoplastic, meaning it fights cancer, but in this case it also helps to regulate cortisol at bedtime. And David can speak to this as well, but having a fiber snack with a little bit of protein right before bed can also help regulate that cortisol at bedtime.
In the last 2 years, there have been 2 medications that have come to market from the pharmaceutical industry. One that's put in the nose called Noctiva, made by Avadel, and then the other is just recently came to market by Ferring called Nocturna, which is an oral medication. They both have the identical compounds within the active ingredient as antidiuretic hormone. Anti meaning not. Diuretic is something that makes you make urine, so it makes you not make urine. That's what it does. So basically fools your kidneys to not excrete urine, and therefore if you're not making urine, you're not going to get up and go to the bathroom. And these drugs have shown to be very effective and will reduce your nighttime frequency maybe from 4 down to 2 or down to 1. And so people are sleeping better as a result of this. Now, as you know, no drug comes without its price besides the financial price. So you have to understand that you might have a change in your electrolytes, so you have to be monitored while you're on this drug, particularly in the first 4 to 6 weeks of being on these drugs. So there is now some pharmaceutical agents available specifically for nocturia. If they're used properly in the proper patients, it might improve your quality of sleep. So as an alternative to nutritional, there's also the pharmaceutical, and then there's also behavior management. The first thing I always try is what are you eating and drinking? When do you eat and drink? What time of the night do you quit eating and drinking? I remember at our first Men's Health event, we had one of the former Red Wings. Who was that? Chris Draper. So they interviewed Chris Draper and they said, how do you keep your weight down now that you don't play hockey every day? And he says, easy. I don't eat or drink anything after 7 o'clock at night. If it's 7 p.m., I'm done. Well, I already am. I don't do that. But I think it's hey, I tell the truth. But I mean, what a great idea, to restrict your fluids and your consumption of foods after 7 p.m. So you give your body a chance to kind of like go into a visceral rest, so that maybe you'll sleep better at night and also not put on those bad calories. And there was a recent article about, I think, prostate cancer in men who eat late at night. Yeah.
Having a late night dinner increase cancer risk.
Increases your cancer risk.
So the earlier you can eat your dinner, the better.
So,
which is easier said than done, and not late night snacking or having a beer. I'm glad you mentioned that too, because alcohol definitely can make you wake up in the middle of the night like that too, if you're having it at the end of the night.
Darn it.
Because alcohol is a sugar bolus. So again, eating late at night, drinking alcohol before bed, we're still talking about the same drivers behind risk of prostate cancer.